cholesterol right now. That is my main concern, as well as inflammation, my chronic pain. I'm in pain every day. I feel like a 60-year-old lady. So I would love to be an advocate. I am actually applying for nursing school at this time, and I'll be going for my master's, which is a nurse practitioner. I mean, depending on how I might be able to help, just because it is so isolating. It is like physicians, I think, don't get me wrong, they're doing their absolute best to do their job, but no one really knows a lot about PCOS. There's not enough.
Most of us that are in PCOS have some experience ourselves dealing with the condition. When I was a teenager, before I was even into medical school, the first symptom that I experienced was weight gain. And I also had irregular periods. And I ended up having to take oral contraceptive pills, which is what most of the providers would recommend when you go in and have a diagnosis of PCOS. And I once I came off the pill and I went to medical school and then I graduated, that's when I realized the pill is just a band-aid. And PCOS has, more things that happen in the background that are never addressed. And, almost everyone that goes in with a diagnosis is always being put in a pill. And especially with my affinity for women's health and women's preventive health, especially, this was like a field that chose me rather than me going in there. So having my own experience and, dealing with it and seeing the need that there was more than just treatment for PCOS, all the holistic ways you could deal with it. I was like, there needs to be more advocacy for women who have been diagnosed, and then for others who do have it but have gone undiagnosed or always suffering from all of the symptoms. There are a set of women who have been diagnosed with PCOS. And one of the main concerns that you have with PCOS is you have irregular periods, you have problems with ovulation. And especially, when it's diagnosed in a young woman, the first thought is, am I going to be able to conceive? So there's different ways that we want to deal with fertility when it comes at the young age. And I just want to say PCOS women do conceive. Is it hard? Yes, but a lot of them do end up conceiving, So also to clear that misinformation that if you do have PCOS, you can never have a baby. And not that is just in the fertility period. And then you move on along with the usual aspects of menopause. You add in someone who has PCOS, and their hormones are in a complete disarray. So how are you gonna, take back your health? Pills are never gonna be the answer at that time in your life. It has to do more with holistic health. So at PCOS Diva, we have different programs. We have a Jumpstart program that we do. We have a program that does a Sparkle program where women can try and detoxify and kind of, regain their health. And we have a lot of supplements, and we kind of divide them into, you discover, you live, and then you thrive, and you become a PCOS diva. We want to bring the same kind of awareness for PCOS as well. And like I was saying, what's put out as treatment is just a band-aid. We want women to, take care of their overall health, which includes very simple day-to-day things, get a good 8 hours of sleep, try and meditate, keep your stress levels low. And, we women, we kind of juggle a lot of things. We are multitasking. And so we're always stressed out. It's okay to say no to some things, cut back on things that are not good for you if you think it's, eating away at you. And how do you balance your life, and what kind of supplements would help, and just taking charge of your health in a more holistic way than just having one prescription and thinking it would kind of cure you. if there is one underlying theme with all of the experts from the different fields that we meet, it is, do not, there's nothing that's a substitute for having good food, good sleep, getting some exercise in, and those are your day-to-day activities. And then if you wanted to go the extra mile, I would suggest intermittent fasting. Fasting from in your day-to-day life has shown a lot of benefits, and PCOS sometimes can be a part of an autoimmune process that's going on in your body that also targets other endocrine systems. It's targeting your thyroid, it could affect your adrenals, your ovaries. And what fasting does, it kind of gives your body time to heal itself. So there's different kinds of fasting windows and things like that. But just having even a minimum of 12 hours where you give your body rest from food really, really helps your body to heal itself. So and of course, this is in addition to taking supplements. And women who are just starting out, just been diagnosed with PCOS, I would recommend to do a complete panel. A lot of them are vitamin D deficient. Look at all of your other vitamins. You could do a measurement of your minerals. Some of them do need magnesium supplements, and see what else you could supplement with when you have a deficiency, in addition to doing your day-to-day routines. To cook some food from scratch, and not completely scratch, but taking a lot of, raw salads and adding that kind of meals into. And there is honestly no one size fits all solution. You could, red meat could work for you, chicken could work for you, dairy might work for you, dairy might not work for you. So you need to figure out what works best for you. And the best way to find that out is to see how your body reacts to it, because we all experience inflammation, and inflammation is not our friend. We want our body to not be inflamed, and you would know that by how you feel. Are you energetic? Are you tired? What kind of foods when you eat, you feel energetic, and what kind of foods are making you feel down, and you're like, why did I even try that? So you need to maintain your own journal and kind of see where you land. And honestly, it makes a big difference. In the end, you kind of choose foods that work for you and work around that. And that's another reason I think fasting also helps, because then you're not calorie counting. You're not saying, I'm going to go all organic window and eating your regular foods. So it is more manageable when you're juggling work and family and all the other extracurricular activities. Who is fatigued, who thinks that they're not able to go on with life like they would with all the energy. You don't have to accept that to be your normal. Dig a little deeper, see if there is a diagnosis that you're being missed out on, because almost 50% of women are undiagnosedly having PCOS. So see if that's a diagnosis that would fit you. Look at your thyroid panel, look at your adrenals, they're all connected. And don't accept that as a way to live. Try and dig deeper and know that you could take in charge of your life, and you could thrive and be your best self.
Excellent.